Good morning, everyone. You're joining me on a very windy Wednesday for one of Western Sydney Community Forum's interactive live stream forums. My name's Tom Nance. I'm the Manager of Policy and Programs here at the forum. And as I begin, I want to start off by acknowledging the traditional custodians of the land that we're all on. I want to pay my respects to elders past and present, as well as Aboriginal and Torres Strait Islander friends who are joining us here today, albeit virtually. Now, obviously, it's a time of uncertainty. We've been here before with our lockdown last year, but it feels a bit different this time around with Delta running riot in our communities. Case numbers are, not necessarily climbing, but definitely steady in the hundreds. And we're seeing the impacts on the ground with the people we're working with most. It's really important for us to have these opportunities to talk and talk more specifically about how it impacts on our contracts, how it impacts on our service delivery. We're lucky enough to be joined by three representatives from DCJ today, both from the head office and also district office level to answer your questions and join the conversation as well. Before I introduce each of our speakers, I just want to let you know this is dynamic. As I've alluded to, you can ask questions and we encourage you to do so. The way I prefer you to ask questions is by raising your hand. That way we can pop you off mute and we can hear your wonderful voice, and you can direct your question to any of our panelists. The second option is for you to use the Q&A function within Zoom. You can just type in your question there, hit send, and then I will make sure it finds the appropriate panelist. Finally, if you're joining us on YouTube today, good morning to you all. You can ask questions by entering it into the YouTube chat, and my YouTube correspondent will relay them to our panel. So on that note, let's kick off. I'm sure we've got plenty of questions and plenty of thoughts as well. I'm looking forward to hearing from our panel. Our first guest today is Eleri Morgan-Thomas, and she is the executive director, of partnerships from Department of Communities and Justice. Welcome, Eleri. Our second guest is Daniel Barakate, and he's the director of commissioning and planning from Southwestern Sydney District, also from DCJ. And finally, last but definitely not least, is my friend Jo Carlisle, and she's the manager of commissioning and planning from Western Sydney, Nepean Blue Mountains District. Welcome to all three of you, and thanks for joining me. And Daniel, good to see you staying safe within the office, mate.
Thank you.
So I'm going to kick us off. I think I might ask you the first question, Eleri. What's one thing that you're seeing that's different during this lockdown compared to our previous lockdowns last year?
Yeah, thanks, Tom. That's a good question. That sort of made me think a little bit. Last time it was all really scary. NGOs didn't know how we were going to react. We didn't know what we had to do either. And in a way, it gave us an opportunity to kind of reset things and to think about it. But everybody was totally engaged in how do we get over this thing. What happened this time is I think there's a lot more of, oh no, not this again, plus a little bit of extra fear about the Delta strain and how that's going. So it's kind of, it's scary, but in a different way from what it was first time. There's more knowns this time. And, it's always easier to do something the second time, but it's still got that, it seems bigger in a way than it did the first time round.
Fantastic. Thanks, Eleri. And Daniel, what about you? What have you seen on the ground that's different from, lockdown number 2, electric boogaloo, in 2021 compared to our last one previously?
Yeah, look, Tom, I think as Eleri said, in some ways, everyone worked so well through the last lockdown and was so resilient. And I think this is a lockdown that we didn't necessarily anticipate. It sort of did start, if you think about it, as a bit of a slow burn, and then it kind of exploded. And I think that has brought with it a sense of anxiety, I think, for many people, and a sense of this Delta variant is a very different strain of virus, and I think people are feeling that. And there's still some uncertainty about how long this will go for, and therefore the ongoing impacts. So I think the context has changed. The great relationships and the ways of working are there, which is fabulous. But I do think, there is going to be that sense of fatigue that we're not sure, where the end will come.
Yeah, that's a really good point, Daniel. And, I think about the sudden explosion. At first it was just a couple of cases and we went, okay, we've got this, we know what to do. And then suddenly it just exploded. And it's definitely, the uncertainty you spoke of is definitely palpable for a lot of the services we're talking to as well. Joe, what about you? What's different in Western Sydney this time round?
So-
particularly since you've got, the three newly welcomed areas of concern in Cumberland, Parramatta, and Blacktown, of course.
Yeah, I mean, our experiences are quite similar to what Eleri and Daniel have said. But I do think the difference has been this time that, providers had their business continuity plans in place and have been able to, pivot, as they say, to different ways of working really quickly to support our vulnerable communities, which has been fantastic. As an example, we in our office in Parramatta had a hotspot a couple of weeks before the lockdown started. So for us, our lockdown started a couple of weeks before that because we all quickly started working from home and doing our work differently because our coffee shop was a hotspot. So that experience happened pretty quickly. And I guess the other thing that sort of has been different is the planning that has been put in place since last year has been able to be put into effect. And I think the community housing apartments in Blacktown have been the perfect example of that, of all the planning that the department has done with other agencies and health and police and the local, community housing and housing providers and stuff has been incredible to see the response to support the people in that apartment. So I think, as Eleri said, last time we really were coming into this like you weren't sure what we were doing, but this time we certainly had the planning in place. But the other thing is, I think there is increased fear and anxiety. There's vulnerability, there's different financial supports, and particularly in these areas of Western Sydney and southwestern Sydney, it's a completely different cohort of people who are kind of experiencing this, and the Delta strain is so virulent that it's going through kind of different sort of occupations than it has before.
Yeah, definitely. So I think, what's clear is there's, a sense that in some ways we're better prepared, in terms of having continuity plans in place, in terms of knowing, what worked last time, but definitely as well the explosion and the speed that the Delta variant has spread has definitely created a challenge. I mean, I know it's, been, tough on our workforce as well, heightened anxiety, in terms of going to work and knowing if they can go to work with these lockdown orders and things like that. One of the things that's recently been announced, I'm aware, is that DCJ is providing EAP support to eligible organisations. And Eleri, I know you're working really hard behind the scenes to make that available. So thank you for that. I mean, Eleri, what's your take on, how organisations can effectively support their staff to take up this service?
Well, to take up the service, organisations just have to register with us. It's and I just want to make clear, it's not us doing the support. It's through Converge, who know how to do that stuff. That's their job. They'd also provide EAP for the department, but it requires each of our funded organisations to to sign up to it, and then their staff can access it. So there's a link. You should be able to get a link through the district. We haven't sent an email out about it specifically because we realised over the last few weeks we've been bombarding people with emails and it was going to get lost. But it's available and out there, and we have the NGOs that had already signed up last time when we offered it. We emailed them directly to say it's open again, so that you didn't have to apply. So all of those already know about it, but certainly through Joe and Daniel and their colleagues, letting people know what the link is. So, I mean, just ask if you don't know. Yep.
Fantastic. And I know, we were talking the other day, Eleri, that, we're a bit surprised with the take-up of the EAP and potentially how we could boost that. So do you think there's anything in particular that services can focus on to really encourage their workforce to take part in it?
Well, I think a lot of it is and when we look, and what you're talking about is relatively low numbers of people of organisations and their employees have taken up the offer. I think that speaks a bit to the resilience of the sector, but like we said at the beginning, this is a bit harder second time round in a much deeper lockdown than we experienced before. And particularly with kids at home as well. Like I really, for people who are have kids in the background stealing all their bandwidth, and all their bandwidth, I mean in all senses of the word, that's actually like really hard, and I would expect some of those people to want support. Now, whether there's a lot of things organisations can do, and my own staff, we've been just yesterday we were talking about what is it we can do to help staff get through this, help ourselves get through it, because we're all in it together. So there's some things you can do there, but some people might need a little bit more, and they're welcome to access EAP. If your organisation already has EAP in place, like we want you to use that. This is for organisations that don't have access to that, and we know that. So, and it's not necessarily, EAP isn't necessarily the answer to everybody. For some people, more practical things like allowing flexibility in the way people work and the times they work is going to be more effective than having a counsellor listen to your frustrations about a rigid 9-to-5 workday or something. So I don't think it's the answer to everything, but I would encourage people to really think about the mental health and well-being of their staff, but also as leaders yourselves, at what you're doing to look after yourself so that you can be a better leader, because it's tough on everybody really, and really tough on frontline workers who will also be worried about their personal risk and exposure.
Yeah, definitely.
Yeah, so look, I acknowledge all of those things. I wish I had the magic answer to it, but I don't.
Tom, can I just add to that, based on our forum we had last week with service providers? There was a question asked about, what if we have, and I've just seen the question in the chat as well, what if we have providers who don't want to sort of talk to a service that's funded through government, or they feel uncomfortable about that, or, what if they're not funded through DCJ, and where can they go? And I guess, there are a whole heap of other counselling services around and available to people, Beyond Blue, Lifeline, all of those services are available as well to support staff and families. So I just really encourage, there are, so many supports available out there as well that people can access.
Yeah, definitely. And look, I do take on board the fact that EAPs and, counselling services are just a number of, tools we have at our disposal as organisations to support our staff through this, and want to acknowledge that as well. I mean, speaking of support, one thing I'm curious to hear from you, Daniel, about is, of course, your patch is Southwest Sydney. We had Delta strain before it was cool and everyone else had it. And I say that as a Liverpool resident myself. But look, in terms of that, what are some of the things that you've been able to do in Southwest Sydney District, particularly in the three, hotspot LGAs, being Fairfield, Liverpool and Canterbury Bankstown, that you were able to do at Western Sydney District to assist services on the ground?
Sure. And I want to start by saying I'm here in beautiful Fairfield, in the middle of the action. And I want to say, firstly, how amazing our communities in southwestern Sydney are, how great everyone has been. I'll talk a bit more about that in a sec. But some of the things we've done in DCJ is really played a role making sure we check in with our providers, providing support and assistance, ensuring business continuity plans are in place and working, and really giving permission for our providers to do the things they need to do to keep their clients safe, being flexible about service provision, helping even to translate some of the really confusing public health messages we sometimes receive, We play an important role also, giving permission to change how we deliver services. All of our providers have pivoted. All of them are continuing to do excellent work for the community, whether it's children, homeless people, older people, and really pivoting to do that in a safe way. And it's been so great to see, really supporting, answering questions, just bringing people together has been a big part of that work. I think the other thing to say that's really important is managing the expectations of some of DCJ staff. I need to acknowledge that sometimes our staff have expectations about, say, what a caseworker might do in a family preservation service, and really making sure that people understand and work together. The other thing we've done a bit of is linking people into wider emergency response supports or wider food services or wider structures, and helping to bring people together. There's a whole range of assistance, for example, emergency assistance for our social housing providers. One of the beautiful things I've seen is our housing providers provide temporary accommodation to rough sleepers, and then in partnership with the local health district offer immunisation. Really practical and simple ways to support the vulnerable have been just beautiful. And really watching our providers really pivot to keep their people and communities safe. I want to especially shout out to our community centres and councils. I mean, we have seen librarians be repurposed to provide food to people. We've seen council rangers be, again, repurposed to be part of a food distribution network. We've seen creativity, we've seen passion, but we've also seen people pulling together and assisting each other. And I just want to say how much we value and appreciate that. In southwestern Sydney, I think the other thing to say is our community leaders have been pivotal in translating some of the messages in a way that makes sense to our diverse communities. We're some of the most diverse places on the planet, and it's been really great to see that being a whole of community response. I also want to say that often there's a lot of stigma about southwestern Sydney, but we are an amazing, resilient set of community with significant social capital. And I want to really express my thanks on behalf of the district for the way that providers have worked with us to really look at how we can continue to meet the needs of our clients and communities. And I think it's that openness and willingness to work together and that collaboration which has been beautiful to see.
Yeah. Thanks, Daniel. And look, there's definitely a lot of richness in what you were talking about. I mean, the role of, agility in this, and the fact that services have been able to pivot so quickly and to support their staff to do things that they wouldn't normally be doing. I think also that, the thing that I've seen on the ground, as a resident, has been the role that community leaders have played, because you're right, there is a stigma about Southwest Sydney and Western Sydney as well. And so seeing the community pulling together around this has definitely been one of the stories for me in terms of the resilience. As I think a politician said, we didn't necessarily start this fire in Southwest and Western Sydney, but we're all, in it together in terms of putting it out. And well said, Daniel. I mean, there are some things I might return to as well. I just want to remind everyone, you can ask questions. I encourage you to do so. Q&A function, raise your hand. I love hearing other people's voices because it makes me feel like I'm a talkback radio host. So anyway, I'll talk to you, Joe, while I eagerly await questions coming in. So lockdown's recently extended to Western Sydney. And I mean, we had of course, the case in Blacktown where the apartment was locked down fairly quickly, and, it showed the rapid response that we were capable of. What impacts have you seen from services in the Cumberland, Parramatta and Blacktown areas so far? Like as lockdown in those LGAs is in its relative infancy, let's say.
Yeah. So we had a provider forum Monday last week, which was really good to check in with our providers in Western Sydney, Nepean, Blue Mountains, to talk about the impacts and pick up any issues from them that we could assist with and that sort of thing. So the main concerns that were aired at that forum were around, how they get staff to work and do work in a COVID safe way. And we had a lot of conversations about authorised workers and, who can be authorised to work and those sorts of things. So we've been able to provide advice and support in that. There are other concerns that have been raised are around access to technology and support for vulnerable people. And it was particularly, we know that lots of parents like myself have our children learning from home at the moment. So it wasn't so much access to technology for families with school-age children, because schools are helping in those cases. But when they don't have school-age children, or if they're on their own, and so it was access to technology and connectivity in those ways. There were discussions and concerns around what happens if a staff member tests positive or a client tests positive, particularly in a residential setting, and so how they might respond in those ways. And then, of course, how to keep supporting vulnerable families when you can't deliver face-to-face services. So they were the questions that have been raised. And also, of course, how do we communicate out to our called communities to make sure that the messaging is getting out? And we've seen some fantastic championing of those issues by services in Western Sydney to make sure that, that is taken seriously and work is put in place to do that. So it's been interesting, though, like they were the issues that were brought up, and our CPOs, contract managers, have been checking in with our providers regularly, but we're not hearing as yet, which is hopefully good, too many sort of specific instances of impacts. I think the planning that was done has really enabled everyone to pivot. We did have one homelessness provider that requested PPE because they thought that a staff member might have been testing positive, but in the end they tested negative, so that was okay. So yeah, I think in that space, the impacts so far, we're not seeing too many specific impacts that we're not kind of prepared for. The other discussion that is coming up is what are the longer term impacts of this, particularly, for example, I was talking yesterday with one of our councils around play groups, and, they're all not happening at the moment because they can't happen face to face. And it's about, when we can have them again, how do we ensure we re-engage families in those services, who when they're happening again? Because I think after the lockdown last year, a number of those play groups, didn't kind of restart, and the families didn't re-engage. And so we don't want to lose the involvement of those groups in these really important community activities after lockdown as well.
Mm-hmm. All great points. So I guess for me, there's definitely that, concern that a lot of organisations have around long term, and the longer term impacts on communities and service delivery as well. And we've got some questions coming in, and I'm going to direct this one to you in the first instance, Daniel. Now, this is from Margaret Tipper. G'day, Margaret. Hope you're keeping well. She's asked, how sustainable is all of this service provision in the longer term? So obviously services are, hitting the ground running, making things happen. How sustainable do you think it is in the longer term? And, particularly around funded services seeking extra funding and help in terms of material relief and food hampers. How sustainable do you think it is in the longer term? And maybe do you know if things are being looked at your district level in terms of the longer term?
Well, certainly to answer that, and it's a very important question, as we move on with this pandemic, there is some uncertainty. Let's be really clear about it, about when this will end, and also what it'll look like. So, some of the health messaging has been very clear that really the only way out of this particular pandemic is around immunisation. So that's been one of the strong messages. So, that if that means that as a government, we're going to have to, and as a community, and as service providers, we're all going to need to think about what that looks like for our service provision. So there may be some changes that need to happen, and we want to be flexible about that. and do it with do it in collaboration with our service providers and our central staff, and also the broader government around what that'll need to look like. So we have a commitment to do that and to do that together and to keep that conversation live. We want, obviously, to people to get the services they need and to have them be whatever they look like in terms of the context. The other thing to say is in terms of food security, if you're in Fairfield, for example, there is a central needs register about food and a really well-developed service delivery network. There's Oz Harvest and other food charities who are working with a range of providers. There's a pathway through Service New South Wales 137788 for food requests and a range of food services and work also going on centrally. So there's as part of the sort of the Resilience New South Wales response, a really big focus has been on food, and so there's more to come in that space. My key message also is if providers have any concerns around their needs, to contact their commissioning and planning officer and have those discussions, and we will do whatever we can to help and to connect and to link people with things. We want to be flexible around service funding. There will be no penalties. We're not in the business of penalising people because they can't do certain things. And we really want to be flexible and open. And we just ask that people have those conversations with their providers. Can I predict the endpoint? No, I can't, but we will be there to have those conversations with flexibility, making sure that we can continue to provide the services we need for our children, young people, adults, and our communities as per our commitment, and we will be collaborative about it.
Fantastic.
Can I add something to that, please, Tom? One of the things we are trying to work out, what are the impacts on organisations in the 8 LGAs and probably others, but specifically those 8 LGAs around additional funding required. But I've been unable to actually get any numbers. Now, anybody who's had anything to do with Treasury, it's not the vibe of the thing. What they actually want to do is like work out what the numbers are. So if any of you are think that you need additional funding, then I would suggest that you tell either Joe or Daniel or your CPO exactly what it is, what that looks like, because that will then, and they can send it to me, and that'll kind of help us work with Treasury about what a reasonable response might be. So I think that's what I actually want, the numbers around those things, because we are trying to coordinate the food piece. And I should just quickly add that we are working with Multicultural New South Wales and some others around the needs of particular communities. And I think you can expect to hear some more about that in the next couple of weeks.
Fantastic. That sounds like good news, Eleri. And definitely, if you've got ideas, if you've got numbers, I know that Joe, Daniel, and Eleri are looking for those, because it makes their job a lot easier when they're making representations within government. So I'm going to direct the next one to you, Eleri. One of our participants has asked what other supports will be made available to providers. Anything else on the horizon, Eleri? Anything you can give us a sneak peek for? I love having breaking news here.
I'm not in a position to break news, and it's not my job to do that. But let me assure you, I am doing a lot of work on what is the understanding what the sustainability of the sector is financially, as my bit of the world. But so we're doing a lot of that based on what NGOs tell us about their financials. Been doing some work with Treasury around, and NCOS has been advocating very hard for NGOs to have a different threshold for applying for the JobSaver money. Now, that's a bit to and fro, and the Commonwealth is involved in part of that decision making. I would encourage everybody to advocate about that if that's what you think. I have been trying to find out how many NGOs access job seeker in the first round. Now, what I know from the ATO, that my estimate that there was probably around 5,000 registered charities in New South Wales who accessed JobKeeper, but the definition of charity is so broad, it includes private schools.
Yeah.
It includes a whole lot of people who are not our sector. What I haven't been able to find out is exactly how many organisations got JobKeeper, because that's actually really important information. So if anybody did get JobKeeper, are happy to share it with us, knowing what types of organisations and how effective it was actually helps us to advocate. I haven't been able to find that out. So I'm really happy to kind of find all of that information out. I'm working really closely with the Commonwealth, with the emergency assistance providers, trying to coordinate some of that with the Commonwealth and sharing information with the Commonwealth so we don't duplicate some of that, and understanding where the pressures come from. Because one of the things, I've been in a very privileged position in the last few weeks where I've got to sit on some of the health planning meetings where they're interpreting data and understanding things about what's happening in the community and where the spread of COVID is coming from and what some of the drivers are of that. Like, it's very sophisticated, data-driven planning, and it's just awesome to be on the inside of it, but also terrifying. But I see some of the communities that we have been talking about, some of the community groups that we've been talking about through the emergency relief, about people who've been missing out, and it's been useful to be able to input some of that and to be, so there will be some announcement about that, but I'm not in a position to tell you what it is.
Yeah, no, that's okay. It was a bit of a forlorn hope for me. But just as well, just to add, Billy and our organisation have also been really active in talking to both Treasury and Ministers directly about I always get my acronyms mixed up, the Job Saver, the Job Maker. It's something with a job in it.
Job Saver in New South Wales, it was JobKeeper.
That's correct.
Yeah.
That's correct. So we're definitely talking at a ministerial level about that as well. And as our members would know, we've been collecting case studies from a bunch of you, and thank you very much to them for providing that data and intelligence as well.
And keep doing it, I would say. I've seen that. I've seen your correspondence, and I've seen it from NCOS, because that gets shared with us as well. And the fact that it's getting shared tells me that you're having an impact. So
it's definitely good to hear, and hopefully watch this space, because we're definitely taking that fight up through Billy and the team. Yeah. So I'm going to move us on. I've got a question for you, Joe, which I'm really interested in. So Daniel earlier talked about public health messaging and also alluded to the fact that, at least at a messaging level, what we're being told is immunisation is one of the key things that will get us out of lockdown in the long term. And I guess this is a tricky question to put to you without giving you much notice, but do you think that the sector could perhaps be playing a role in this space in terms of breaking down that message for people who it's working with, particularly those who are working in residential settings? And have you seen organisations pivoting to this point already at this stage?
Yeah, so we met with some of our residential care providers in Western Sydney last week and discussed, access to vaccinations for staff and for people in those spaces, whether it be in the homelessness space or in residential care for children and young people in care of the minister. And fortunately, some of our providers in that space are also disability providers, so their staff had access to vaccinations early on in the piece, so that's been really good. And there's also been a really strong concerted effort from the local health district to work with all the homelessness providers, the refuges, the youth refuges and those sorts of things, to make sure that staff have been immunised. But certainly I think there is a real opportunity for us and our providers to really promote the importance of vaccinations to our staff and our clients, and to really talk, to our networks and to our partners in health to see, what might be the easiest way to go about that. I know just internally within our district for DCJ staff, we've been sharing links to the Hot Docs app and the other eligibility apps for, staff to go through to sort of check where they can get a vaccination. And, you know, to get an AstraZeneca vaccination, you could really just go and get one tomorrow if they're so easily available, and there's lots of walk-in centres and those sorts of things. So I think the more we can promote where those are available, the better, and also in community languages, and debunking myths that are surrounding those, because really, you know, as the Premier keeps saying and others keep saying, the only way out of this is if we do get to a point of having a significant part of our population immunised, particularly in our southwest Sydney and Western Sydney, where so many of the, you know, the workers that are keeping this state running are living. And, you know, they're the ones that are keeping all the distribution centres going and all the, you know, construction going and all of that sort of thing. So it's really critical. But yeah, I would really encourage providers to reach out to, you know, partners and sort of, you know, build on the relationships that they have with health or their local, you know, GPs or those sorts of things, to see what can be promoted and supported locally.
Yeah, great points, Jo. And look, I think you're right in that partnership's the best way to move forward. We're definitely not expecting any community organisations to overnight become, you know, epidemiology experts. But definitely there's scope there for services who have the capacity to do so. Now, there's a lot of questions coming through. One that I'm interested particularly in your take on this, Daniel, which is asked by Victoria from Cumberland City Council. And she's alluded to the fact that, you know, in the lockdown LGAs, there's a real, I guess, you know, need for us to do things COVID safe. Often the temptation is to take everything online. But we do know when we do take things online, there's a significant proportion of the population who we work with who we suddenly lose connection with, either because they're not technologically literate, because they don't necessarily have stable internet connections, devices, etc. She's asked, are there any other COVID-safe approaches to maintain connection and reach with the community who can't do so online? And have you seen this play out in Fairfield? I imagine you would have.
Look, the answer is yes. Obviously, each situation needs to be considered in terms of a number of things. One, the context of that particular relationship and that service. So, for example, in the out-of-home care space, family contact to support restoration absolutely goes ahead. In the child protection space, not only do our caseworkers continue to work with families on a face-to-face basis, but so do our intensive family preservation programs. They might do it differently. They might do it on balconies, in different contexts. They wear, and you know, they all have to wear masks and PPE, but it's absolutely done. So there are ways that can be done where it's appropriate and safe to do so, and where organisations can mitigate those risks through their continuity plans. And, you know, we've also assisted organisations. So people in my team have driven out and provided additional masks and gloves and gowns to people. And, you know, my message is, if you can't access things through normal channels, I understand that your supply chain is working better than it did last lockdown, but we're happy to help with any of that. Just reach out to your CPO. But my advice is, you know, the actual the public health orders say you can do essential face-to-face work. It's just about, in those circumstances, making sure it's safe. And we've seen some really creative ways of people continuing to support very vulnerable people, really beautiful things. We've also seen people who've, you know, because of various risks, who've talked through doors and made it work. We've seen people deliver care packs to show people that they're thinking of them. We've seen people, I know it's not video, but, you know, just regularly ringing people. We've seen a whole range of different responses that aren't always virtual. And it is really about the particular service, the particular relationships, and the particular work. So it's very hard to give blanket responses, but I've seen it in a number of different contexts work really well, and mixing different approaches. Our own staff, as I said, are continuing to go out and will continue to do so. And so it's just about making sure we can manage those things and keep people safe.
Yeah.
And Daniel, I did say in the chat that we did some case studies on that last year, so we should find them and circulate them.
Yeah.
yeah, we'll definitely make them available for all our audience as well. So stay tuned for that. So we have a lot of comments and a lot of questions as well. One comment was, it's encouraging to hear all the great work we're doing. And it would be great if this feedback was sent up to the top level of government and it's acknowledged and communicated on TV, the news, and to the general public, as the media at present feels have been really discouraging. I know as a resident, sometimes I don't often like hearing the news and how we're portrayed. So it's a great point. Well done. Nisha Eckersley has said, thanks for the regular COVID-related comms. They're really useful. And thanks for joining us, to the three of you. We do have a question. We've got a lot coming in, actually, but we do have a good question from EMDA, the Multicultural Disability Advocacy Association. Thanks for tuning in. And the question is, I might throw this one to you, Eleri, because that's my strategy with a lot of questions I don't know the answer to. Do you think vaccinations will be legislated for workers in the aged and disability sector, as it is concerning that there are still a lot who are not vaccinated and could impact on people with disability who have comorbidities? Is there anything you're hearing about that?
Well, certainly from what I know about the media, that actually sits with the Commonwealth around some of those, and because industrial relations law sits with the Commonwealth. And it's an industrial relations issue, basically, if you require people now in to have a vaccination. So what's the equivalent that I see in the rest of my work? You can't do particular roles in DCJ unless you have a working with children check. So it would have to be a thing like you would have to require that, and it would probably have to be a change to industrial relations law. I know the Commonwealth is looking at it because it's got consequences. Because if you say everybody must have a vaccination and then for a whole lot of reasons people can't or don't get vaccinated, you could lose a third of your workforce.
Yeah.
So then what do you do? So how do you manage, where do you get other people from to work in aged care? So those are the sorts of things. I don't have a crystal ball to predict what the answer to that will be, but I think it's certainly something that employers are looking at really hard to go, what are my obligations here? Yeah.
And I know that within the early childhood space and childcare workers in particular, there was the protracted reform, if you will, and movement around moving to vaccination in that industry. So we do know that it's not without challenges in making that happen.
Yeah.
Another question we had, and I might hand this one to you, Joe. So there was data that came out yesterday about vaccination rates that was really interesting and concerning if you're in our patch. Western Sydney and Southwest have some of the lowest vaccination rates in terms of people who've got only one vaccine, but also people who've got both of their jabs. We're sitting, particularly Southwest, in fact, is sitting quite low in comparison to state averages overall. And the question was, so they came out yesterday, and some portions of the population, some districts have a much higher rate of vaccination, which, one could conclude means they have better access to the vaccine. What do you think is playing out to contribute to that, in terms of what you're hearing on the ground, but also how do you think we can start to shift that?
So I would love to say I'm an expert in this space, but I'm absolutely not. And I'm really just going on, what I follow in the media and read in reports and those sorts of things. But I think, from what I've read, I think particularly for these parts of Sydney, it's a lot of it is to do with the demographics, in that they have a much higher proportion of people who live in those areas who are younger. And the rollout of the vaccines that we had, to start with, was targeted towards older age groups. And so my understanding is that it's, the limited supply that we've had of the AstraZeneca and the Pfizer in Australia has meant that those younger age groups haven't necessarily had, the availability of it locally to get it. So I think, that's the first instance. And, the government seems to be responding to that by pulling it in from other areas that are, not impacted by this outbreak at the moment, and looking at other ways to get it into the areas. And there's also been the messaging that's come out around AstraZeneca, and that's been unfortunate. It's about leaving it up to the health professionals and the people that know these things to help explain the benefits of being vaccinated, as opposed to the absolute disadvantages and complexities of catching COVID and, what can happen. And we are seeing that play out at the moment in terms of the increasing number of people that are going to hospital, the younger age groups of people, and, the unfortunate numbers of people who are dying from it. So I really think, it's difficult because of the supply and demand issues, but yes, probably not as much as I've been able to talk about it for quite a while. I'm probably not the expert in this space, but going on what health experts are saying, this is our only way out of it. And I think we need to vaccinate ourselves, not only for our own personal safety, but the safety of our loved ones, the safety of our children, the safety of our parents, and our colleagues, because the more of us that have it, the less the viral load that's going out there, and the less it will be spread around.
Great answer. Enough jargon in there that I
know
you as an expert, Joe.
I'm addicted to Norman Swan, so I'm fine.
Thanks for that answer, though, Joe, and definitely some real key points in terms of our population cohort in Western Sydney, and why, both in terms of our demographic, but also in terms of some of the barriers we face that it can sometimes be stacked against us when we're looking at getting that percentage a lot higher. I mean, we've got time for a couple more questions. I'm aware it's running away from us now as the floodgates open with questions. One from Rose. So she said that our members are grateful for support and advice, but many are still reporting concerns about access to fresh food, and some tenants also being extremely challenged in the homeschooling context in both capability space and mental health. Have there been any new support measures made available in this regard? Eleri, I might go to you on that one.
I know education's certainly responsible for providing devices and stuff like that, and so schools may push back on that, but people should push back on schools, because I know they have a number of devices stockpiled. Some of the stuff around supporting mental health and having kids at home, Joe can attest to how hard that is. It is tough, but I think it's about the best you can do, I think, is to talk to people through that stuff. There's no magic. I'm not sure what the magic support is. There may be things that NGOs can do around access to internet services and things like that. So that might be there might be some supports you could provide there, or something like that, if you've got the resources to be able to do it. If that's sort of an ongoing issue, I'm kind of keen to hear a bit more about that, and what's a practical thing that might be able to be done there. And also, nobody knows how long kids are going to be at home either. It could be that this goes on for the rest of the year, but I don't have a crystal ball, and you'll appreciate it takes a little while to think up a program that you want to do, find the money, and then work out how to implement it. Like, it's actually incredibly hard to be able to do something tomorrow, even with all the best will in the world. Not because government processes are slow, but you've got to get the money from somewhere, and you've got to know how to implement it, because a really badly implemented thing is sometimes worse than doing nothing at all.
Yeah.
Can I just add to that, Tom? So I heard yesterday, in terms of kids who are in public education, that the Department of Education stockpiled a heap of technology after lockdown last year. So really, if kids are at their local public schools, to push back and ask for devices and support. There's also an incredible amount of sort of fact sheets and tools and resources on the Department of Education webpage for parents, including sort of mental health and other sort of tips and tricks and those sorts of things. But I heard a great story this week. Noram Birong, who's one of our Aboriginal out-of-home care providers, is working with a local, I hope I've got this right because I'm telling the story, working with a local technology company, and has managed to secure a heap of resources for children and young people. So I guess I would encourage, providers to also approach private companies and, sort of ask for, support at this time if they are kind of hearing of those things too. Like, this is a time where we all need to come together as a community and, work out how we can assist each other. So I would, really encourage those kind of relationships to be made and approaches to be made to do that, go get that support too.
Can I just echo what Joe said? In our service provider forum, what was beautiful to see is where different providers put up their hand and said, I know this organisation who provides technology to this group of people, and that people shared each other's each other's contacts. It was actually so beautiful, and it again talked to the social capital in southwestern Sydney and people's willingness to pitch in. The other thing to say is that schools are still open for those who need them. And so we've seen some good negotiations where providers have negotiated for kids to go to school for a couple of days where the circumstances require it. And that's been a really good outcome for everyone. So again, it's about working together with your schools and your networks around some of that as well.
Yeah, definitely. And I guess for me, that's really, shone through the ability for organisations to pivot in that tight space and use their networks to deliver positive outcomes. It's what we've always done as a sector, and what we're increasingly doing as well to meet that high demand. There was a question from our audience as well, from someone who was curious about whether any of us had our AstraZeneca jabs. Normally I don't get to answer questions. It's your job, but I can just say, yep, I've had my first. Had it last week, in fact, as one of the cohort that's under 40. Joe, Daniel, Eleri?
I'm fully vaccinated. I was lucky enough to get slots at a newly opened vaccination centre, and so yeah, fully vaccinated.
And I went out to the Olympic Park hub for number 1, and I'm having number 2 just up the road on Saturday for AstraZeneca. Yep.
And when I booked in, which was about 6 to 8 weeks ago, at that time I was only eligible for Pfizer. So I did book in for Pfizer then, and I'm getting it next Monday along with all the HSC students out at Olympic Park. So I'm a bit nervous about that. But I did weigh up those options because I had that booked in. There was that, for me, it was like, I want to be vaccinated. Do I get rid of that and have AstraZeneca? But because of the time difference between the two, there was a lot of weighing up for me. So yes, anyway, next Monday for me, and bring it on.
Yeah. Thanks, guys. Thanks for your honesty on that one. And thanks for the question, our audience. And so, look, we're just about to wrap up now. And I will say we've been taking note of your questions as well. And please make sure you, reach out with them, and we'll try to get them answered as best as we can. But I, of course, have to wrap this up. So just quickly for all of you, and I think I'll go to you first, Eleri. From your perspective, what's the one thing that services need to focus on over the course of this lockdown, acknowledging we really don't know when it's going to end?
I think it's about, we don't know where it's in, so be resilient, look after ourselves, and really importantly, stay at home. I mean, don't go out and do things unless you have to, and if there's other ways to support clients, do that.
Definitely. Daniel?
My key message is we want to continue to work with you. Let us know how you're going. Keep those business continuity plans live. Let us know how we can support you. But also thank you for the work you do and for your communities. We really value it, and you guys are amazing.
Joe, what are your
So my final comments, and similar to Eleri's and Daniel's, but really it is make sure your continuity plans are up to date and that you're preparing for a whole range of different scenarios. I think planning is the best measure, but really, again, it's, look after yourselves and your staff and your families and your loved ones. We in this sector, work to look after other people. That's why we work in this sector. That's what makes us tick. But it's also really important to look after ourselves and our loved ones through this, unprecedented time.
And Tom, I'm just going to jump in and have a second bite of the cherry. When we first went into this last time, we said to you, we trust you. We trust you that you will use your local experience and your practice wisdom to know what to do. Can I say that you've repaid us in buckets, and your success is our success? It's actually been a fantastic thing that has happened through adversity, that we have kind of reset some of those things. And the way Evolve managed, the community housing provider managed the situation in Blacktown with the block that got COVID, has really demonstrated how well the community sector can step up in things like that. So thank you for that, and we have noticed. And I think that's a really good thing.
And can I just also jump in and say, my other key message is Southwestern Sydney and Western Sydney are the most amazing places on the planet, and we should be proud, as you all should, of the work you do and your commitment to each other and your loved ones and the broader community. So I think it's important we acknowledge that. Like, there's lots of stigma, but it's all rubbish. And, these communities are amazing.
Well said. So I'm going to thank the three of you for your time and your insight as well. Firstly, thank you, Eleri Morgan-Thomas, who of course is the Executive Director of Partnerships at DCJ. Thank you to Daniel Barakate, who is the Director of Commissioning and Planning in Southwest Sydney District. And thank you, of course, to Joe Carlisle, who is the Manager of Commissioning and Planning in Western Sydney and Nepean Blue Mountains District. So I'll get you all to pop your cameras off. Thanks for joining us. So just quickly to all our viewers, thank you for joining us. It's been a tough time. It really has over the past few weeks, but thank you for staying the course. You're doing amazing work and it's been noticed. And the impact that you're having on the communities is making a real difference. And I say that both as a worker at a peak organisation, but also as a resident. I want to put out there as well, we've seen a number of issues raised in the Q&A today. If you're hearing about issues on the ground, if you think there's something we should be across or we should be making representations about, please don't hesitate to contact us. It may come as a surprise to all of you, but I don't mind a chat. So please reach out to me or one of our team members where we can talk about it, because it's really important that we're all on the same page when we're delivering on the ground and also feeding back up into the various decision-making processes. That's about it from me. I just want to echo what our three panelists said. Take care of yourself, look after yourself, and please don't hesitate to reach out to whoever you need to, whether it's friends, whether it's family, whether it's through an EAP or whether it's through other external services like Beyond Blue. It's a marathon, not a sprint at the moment, so please take care of yourselves, and no doubt we'll see you at the finish line. Take care, and I'll see you all soon. Bye.